জমিতে মেঘালয়র মাটিতে বিশ্বায়ন রে অমর বিশ্ববাসী আজি জনাও আমি ঐক্যতা নর মর্মবাণী অমর বিশ্ববাসী আজি জনাও আমি ঐক্যতা নর মর্মবাণী লা 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 है हमें विश्वास साथ चलने की हर दूरियों फासलों को दूर हटाने की है हमें विश्वास साथ चलने की हर दूरियों फासलों को दूर हटाने की आशाओं के सफर में रास्ता है सुहाना जीतेंगे हम हमें ये निभाना अगर है प्रेरणा यूं हमारी सदा रहे आपके आभारी This is the state, it is the place where dreams come true. This is the state, it is the kind and new life true. La 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 la.
Thank you, sir. May I now request Dean School of Allied Medical Science
and World Physiotherapy Day 2022. It's a very significant day actually, because people have gradually come to know about physiotherapy and its utility actually. Physiotherapists are nearer to patients and public at large. It's a great privilege to be present in this auspicious occasion. Dr. Richard, orthopedic surgery has gone, orthopedic as a medicine has gone a long way actually. Now they can look into inside the joint with an arthroscope, and they do everything to alleviate pain. Pain is the main thing, and osteoarthritis. Today's theme is osteoarthritis. Everybody, whether you are 20 or 40 or 50, that you are bound to suffer, and it's a kind of aging process, and it afflicts everybody, both male, female, and as you advance in our age. And this is a good team. Dr. Dicky Richard could enlighten us. And he was a student in GMC while I was there as a teacher. And today I'll be his student. Thank you very much. And we are expecting Surobi, Polita, Manikor soon. No? Is she coming on the way? Okay. So we'll hear from her also. She's an anesthesiologist. And anesthesiologists nowadays, it is not just making people unconscious for surgery. They do a lot actually. It's now it has become critical care medicine. So it's a great occasion. We are eagerly waiting for her to listen to her. And thank you very much. Please enjoy. And children, you take notes, if necessary. And if you, we will have a interactive session. Dr. Richard will answer whatever your query is. Adapt in many languages, you answer it. Thank you very much. Welcome all.
And the underlying bone, and it most commonly affects people from middle age onwards, and it causes pain and stiffness, and it affects especially the knee joint, but it might also affect the hip joint, and the carpal metacarpal joints of the thumb joints are the other joints which are most commonly affected. So having said this, it does affect each and every joint of the body. So including the small joints of the hands and the foot are also prone to develop osteoarthritis. So since we are talking about the knee osteoarthritis today, so let's discuss a little bit about the anatomy of the knee. So the knee, it is, as you know, made up of 3 bones: the femur, the tibia, and the patella. And there are a lot of soft tissue supporting structures. So within the knee you find the meniscus, then you have a lot of ligaments which are present inside the knee. You know about the cruciate ligaments, the anterior cruciate ligament, the posterior cruciate ligament, and on both sides you have the collateral ligaments, and then you have a layer of synovium and the capsule. So they all form a part of the normal knee, and osteoarthritis affects all these structures. So when I talk about osteoarthritis, it is not only the cartilage which is breaking down, but along with it, all the soft tissue structures, adjoining structures, are also affected. So you have, along with osteoarthritis, you have ligamentous dysfunction. So the ligaments over a period of time, over age, they become lax. And then you have degenerative changes within the meniscus. The meniscus also breaks down. You have tears happening due to the degenerative process in the meniscus. And then from the edges of the bones, there are bony spurs which are coming out. So these are called osteophytes, and these osteophytes, they impinge upon the soft tissue structures which are closely present across the joint. And then once the cartilage breaks down, so beneath the cartilage you have the subchondral bone. So the subchondral bone undergoes a lot of stress, so which results in bone remodeling and sclerosis. And then you have sometimes synovial hypertrophy, and due to synovial hypertrophy there might be effusion, that is collection of fluid within the joint. So this is what a healthy knee joint looks like. On the left you have a picture of a healthy knee joint, so where you can see a glistening, good cushioning of the cartilage. And then on the right side you have an arthritic knee joint, so you can see that the worn out cartilage results in exposure of the underlying subchondral bone. So a normal knee joint x-ray would look like this. So you can see that there is good alignment, and there is good joint space. So whenever we talk about the knee joint, you always remember that there are 3 compartments. So one is the medial tibiofemoral compartment, then you have a lateral tibiofemoral compartment, and there is another compartment which is present between the patella and the femur. We call it the patellofemoral compartment. So these 3 compartments are always to be kept in mind. So whenever we talk about osteoarthritis, we talk about which compartment is being involved by the arthritic process. Alright, so next comes a picture of an osteoarthritic knee joint. So you can see that the joint space has reduced on the medial side especially. So how do you know that? You know the fibula is present on the lateral side. So on that side you can see fairly good amount of joint space. On the medial side you can see that the joint space has reduced. See, when you see on X-ray, we call it the joint space, but there is actually no space. It is covered. It is the cartilage that you see in the space. So when the cartilage is gone, when the cartilage wears out, the joint space is going to decrease. So that is what you get to see on an X-ray. So you can also see from the edges of the bones there are small bony excrescences. The arrows which are marked in number 2 over the patella, on the edges of the tibia, you can see small bony excrescences, bony spurs. These are osteophytes. So as a result of the wear and tear process, certain bone remodeling process also takes place, and these bony osteophytes outgrowths, they occur. So next comes, why does arthritis of the knee happen? So number 1 is osteoarthritis. It's as I told you, we call it a primary osteoarthritis, which is age related. So greater the age of the individual, over a period of time, there is going to be certain amount of wear and tear. There is going to be certain amount of degenerative process over a period of a patient's lifetime. There is going to be certain amount of wear and tear. So that results in osteoarthritis. So the greater the age of the individual, greater would be the degree of osteoarthritis that we can expect in a patient. So increased load. By increased load, I mean the body weight. So if the patient is a very obese individual, he might have osteoarthritis at an earlier age as compared to a patient with a normal body weight. So next comes it might be post-traumatic. So when a patient has suffered from trauma in course of his life, so be it a fracture, especially if it is an intra-articular fracture, where the surgery
बाबा फिजियोथेरेपी लैब से निकल लाए हैं हड्डियाँ।
तुम्हारे घुटनों का ग्रीस कम हो चुका है।
अच्छा।
तुम्हारे घुटनों के दर्द के लिए मुझे कुछ तंत्र मंत्र करना पड़ेगा। तुम इसके लिए तैयार हो? आराम से बैठी हो? ऊपर वाले इसके घुटनों में भर दो क्रीम और बंद हो जाएगा इसका स्क्रीन। चुप। 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 आपका तंत्र मंत्र हो चुका है और आपको मैं एक चीज देना चाहता हूँ जो स्पेशली लक्ष्मी चिट फंड से आया है तुरंत, जो 21 दिन में आपका दर्द खत्म कर देगा। ये लीजिए, आप ये चूरन लीजिए, आपका दर्द 21 दिन में खत्म हो जाएगा।
उज़ा ठीक है सर, उज़ा
21 दिन हो गए लेकिन बाबा के तंत्र मंत्र से उनका दर्द ठीक नहीं हुआ। कोई भी सुधार नहीं आया। कुछ दिनों बाद उनका बेटा हॉस्टल से घर आता है और अपनी माँ को दर्द में देख उनके पास जाता है। फिजियोथेरेपिस्ट के जांच पड़ताल के बाद ये पता चलता है कि उनको ऑस्टियोआर्थराइटिस की बीमारी है, जो आजकल फिजियोथेरेपी के द्वारा नियंत्रित की जा सकती है। सिड एक सॉफ्टवेयर इंजीनियर है। दिन भर कंप्यूटर के आगे काम करते करते उसके गर्दन में बहुत ज्यादा दर्द रहता है। एक दिन अचानक उसे काफी ज्यादा दर्द हुआ और तभी उसके दोस्त ने उसे कहा,
₹10 का ओवर एक्टिंग का।
आज कितना ज्यादा हो गया, बहुत दर्द कर रहा है। अरे कोई बात नहीं, नहीं चाहिए। मेरा एक दोस्त है, WhatsApp फिजियोथेरेपिस्ट है, चलो हम इसे दिखा के डालें। ओह ऐसा क्या? ठीक है तो चलो।
अलग है।
फिजियोथेरेपिस्ट के जांच पड़ताल के बाद पता चलता है कि सिड को सर्वाइकल स्पॉन्डिलाइटिस की समस्या है। ये समस्या फिजियोथेरेपी द्वारा काफी हद तक नियंत्रण में रखा जा सकता है। रॉकी नाम का एक बॉडी बिल्डर है जो अपने शरीर का बहुत ध्यान रखता है। एक दिन जिम में कसरत करते वक्त उसे अचानक से मांसपेशियों में दर्द महसूस हुआ। ये देखकर उनका दोस्त उन्हें एक फिजियोथेरेपिस्ट के पास ले जाता है। रॉकी को फिजियोथेरेपिस्ट के द्वारा पता चलता है कि उसको मसल स्पैज्म हुआ है। मसल स्पैज्म एक्सरसाइज करने वाले लोगों में आम है, जो फिजियोथेरेपी के द्वारा पूरे तरीके से ठीक किया जा सकता है। राजेश एक दुकानदार है। लंबे समय तक धूम्रपान की वजह से वो कई ज्यादा बीमार रहता था और उसे बहुत ज्यादा खांसी भी थी। तो इसे देखकर उसके दोस्त उसे फिजियोथेरेपिस्ट के पास लेके जाता है।
हाजीमुल नेक्स्ट टाइम पेशेंट मेरे
पता
पास ले
लगता
आना।
है कि राजेश को ब्रोंकाइटिस था और ब्रोंकाइटिस फिजियोथेरेपिस्ट द्वारा आसानी में नियंत्रण में रखा जा सकता है। एक माँ अपने बीमार बच्चे की हालत की वजह से बहुत परेशान है। एक दिन उनकी सहेली आती है और फिजियोथेरेपिस्ट के द्वारा जांच पड़ताल के बाद उन्हें पता चलता है कि बच्चे को सेरेब्रल पल्सी डिसऑर्डर है, जो फिजियोथेरेपी के द्वारा ठीक हो सकता है। थैंक यू।
Physio is the one who heals the body through movements, or he is also called movement scientist. Physiotherapy is not only helping patient to get relief from the pain, but also helps in so many other things like posture correction, where we work on alignment, balance, and correct posture. We improve flexibility by doing some stretching and some other manual therapy, and we also enhance strength by doing the strengthening exercise. And the most important thing is the function. We are the one who improves function when you are having any dysfunction. At last, I want to share a short story with you all. Somebody asked me, "You are a physio, how much do you make?" I replied, "How much do I make? I can make holding your hand seem like the most important thing in the world. I can make you walk when you can't. I can relieve your pain when pills can't. I can give you hope when you have lost one. I can make you get up from a wheelchair. I can keep you fit, healthy and strong. I work all day to make any patients live. I will drop everything and run to make sure you never fall. Today I might make your life complete. How much do I make? All I know, I make difference within you. Proud to be a physiotherapist. If at last wishing a very happy World Physiotherapy Day. Sorry, knowingly or unknowingly we committed any mistakes, kindly pardon us. Please, thank you.
Indeed, that was a very nice try from the students of our BP.